The latest is a close contact of one of the 8 cases we reported yesterday. The ministry, working with the county governments, has traced 646 persons who had come into close contact with the confirmed cases. 96 of these contacts have already been released from our follow-up program after completing the 14-day follow-up period. Those remaining in our follow-up list are 550 persons. All the patients, except one, who is at the coast, are still in stable condition and improving. 11 individuals are currently admitted at Bagathi Hospital awaiting test results. Yesterday, if you recall, we also addressed the issue pertaining to the public transport sector. We reminded those operating in this sector to adhere to the directive we gave on March 20th, 2020. It has come to our attention that several public sector transport operators have now resorted to increased fares as a result of this directive. I want to make an appeal to those in the matatu industry and others in the transport sector not to increase fares for our commuters. By so doing, it will be counterproductive as we continue to fight this virus in our country. You will remember that I had said from the beginning that every sector is going to take a financial hit in this crisis, and to expect that one sector is going to punish everybody else for them to maintain a scenario where they are earning as much as they could is immoral and unfair. And then therefore, we are appealing to the matatu sector to kindly look at the situation, understand it, understand that the commuters they are carrying are not in the same position they were in prior to this. Some of them are not earning any money at the moment, and to appeal for their reasoning. As we indicated yesterday, we have suspended all flights effective midnight 25th March 2020, international flights, as one of the key measures to prevent importation of additional cases in the country. Let me reiterate that all passengers coming into the country between now and that day, Wednesday, midnight, must undergo mandatory quarantine, either A, at their own expense in hotels, in government-approved hotels, or in designated government facilities. I want at this point to issue an apology from the Ministry of Health and other government agencies that are involved in this exercise to the parents and the individuals who have been so inconvenienced since last night. We are aware that we had logistical challenges that we encountered as a result of the speed at which we wanted to move into quarantining individuals. And therefore we know that we inconvenienced people substantially, and for this we can only apologize and mitigate by saying it was absolutely necessary that we do so. I also want to thank those hotels that have already admitted the quarantined people, but to make also a passionate appeal. In a manner of speaking, business has been brought to you by steroids. We are appealing to you. These are people who came into the country without a plan to spend money in a hotel. If your normal charges in a hotel room are 12,000 shillings, you should be charging no more than 50% of that, or even 25% of that. This is business you didn't expect, and you are not going to get it. So to expect a person who had no plans of spending time in a hotel to spend or to pay the rates that you normally charge anybody else is again immoral and inconsiderate. So we are asking you, the hotels that have offered themselves for this purpose, to also charge reasonably, reduce the rate as part of your corporate social responsibility. It would help Kenyans. We are encouraged to note that majority of the people have complied with the measures we have so far announced. We continue to appeal to Kenyans to take the matter seriously and strictly observe the advisories issued, which are all aimed at containing the spread of the disease in our country. I thank you, ladies and gentlemen.
Questions?